Thank you for joining us for this episode of This is Getting Old, Moving Towards an Age-Friendly World. This 10-part series is sponsored by AARP's Community Challenge Grant and George Washington University's University Seminar Series, and is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities. Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today I'm going to be sharing a recent initiative that I've been working on with some colleagues called the AARP Age-Friendly Social Innovation Challenge. This is a 10-part special series, and today I'm going to be talking about part 9, which is social participation. So this series is related to several regional events that we've held at George Washington University's Center for Aging, Health, and Humanities with our 5 regional age-friendly municipalities and multiple partners. If you missed the overview, please check out part 1, which is episode 89, if you're looking for it on my website, melissabphd.com, or on my YouTube channel. So in a nutshell, the morning session was spent learning about design thinking, and then participants were paired by domain of interest. And these domains are reflective of the World Health Organization and AARP's framework for age-friendly cities and communities. So social participation is defined as the opportunity to socialize with others. Regardless of your age, loneliness is often as debilitating as a health condition. It's equivalent basically to having a chronic illness or a disease. In fact, social isolation, most of us actually experience this during COVID-19, is equivalent to smoking about 15 cigarettes a day. So communities that are designed for neighbors and friends to interact can reduce sadness and isolation by having accessible, affordable, and fun activities for everyone who lives, works, and plays there. So there are many issues related to social participation for older adults, and in order to focus the group's thinking and problem solving, a scenario was designed by our design thinking team. From there, the group devised 5 different ideas for a way to solve this problem, and then they had to choose one to develop into an innovative solution. The participants included university students from the DC metropolitan area, older adults, and local leaders who live in the region and work in the age-friendly space. Groups were free to come up with ideas based on what they felt like was the biggest priority for the subject or of their scenario. And then they were instructed to think about solutions without concern for practicality, financing, or what policies would need to change in order to make their solution a reality. As you listen, you may also have an idea for a solution or know of a program that would help older adults and their families facing similar challenges related to social participation. Please add your comments below this video. We'd love to hear from you. So now let's listen in to hear what they came up with.
So on behalf of my group, we had a great conversation focused on ways to improve social participation. So I'll start with the scenario that was presented to us. We were working through this through the lens of Roger, who is 88 years young. He's a retired concert jazz pianist and lives in a small townhouse in Washington, D.C. There's a senior center a few blocks from his house that has weekly game nights and provides a free dinner. And according to Roger, he could walk over there, but would rather not. And he did indicate that he had some physical problems. Specifically, his doctor had told him during the last checkup that he had lost 15 pounds. So this is a short scenario, but it raised a lot of questions in our group. Specifically, given his job as a concert pianist, we weren't really sure about his finances to be able to afford, certain care, or, how that affected his housing situation. There were issues that we talked through regarding his health condition, whether his weight loss was related to any other chronic condition, or whether it was an access to healthy food issue, depression, any number of age-related conditions. We also talked about not wanting to impose our thoughts on Roger's situation, not knowing what his personal desires were. We naturally started to talk about isolation and engagement, but we wanted to be sensitive as to whether Roger had the desire to connect with his community, or if he had a sense of purpose, whether he was living his best life or looking to kind of improve on some of the engagement activities in his community. We also talked about his desire to participate in the game night at the social center versus an interest in maybe pursuing other programming versus an interest in not necessarily wanting to go to the community itself. And the reason I bring up all of these questions is to say that there's definitely a connection between social participation and an individual's health. It goes both directions. A lot of times limitations in our health will be a barrier to engaging in social activities, and vice versa. Being isolated and less socially engaged can lead to some social or some age-related problems also, like depression or other chronic conditions. And so for us, our problem statement really focused after all of this conversation on trying to identify ways that older adults like Roger need to take to thrive physically and emotionally, because according to this scenario, he appears to be isolated and has a deteriorating health condition. So, there's a lot going on with regards to trying to make sure that physical and emotional health is attended to as you get older. So our solution on the next page was really to look at medical care as the entry point to providing community services for Roger. It's really important, we think, that his primary care physician, his annual wellness visit, or his regular visits to his doctor, being the entry point to medical care, is really the start of the conversation to help answer a lot of the questions that we had discussed earlier. Tried to identify the source of the weight loss, trying to identify potential desires that he might have to engage, limitations, access to food, anything related to social determinants of health. So using that access point through his doctor as the entry point for these conversations. Now, recognizing we have a limitation in primary care physicians, there's a limitation in our healthcare capacity to attend to the growing population of older adults who often have multiple chronic conditions, who need a little bit more compassionate engagement when it comes to understanding their personal situation. We don't want to overburden or overtax primary care physicians in this situation. So our real kind of moonshot idea is to leverage this entry point through the doctor's office by creating a new position, a new role of a community health navigator that would be developed to address both the underlying medical conditions and find meaningful connections with the community in regards to his health and personal life. And this new role would really work to extend the medical journey for older adults and connect medical care to the needed social services that are really what my understanding is. Those social and community services are really key to healthy longevity, key to maintaining health, providing purpose. And so this role of community health navigator, through basic conversations and through basic intake of needs and wants and desires, can really identify a personalized approach to not only addressing the medical conditions, but also connecting to those needed services, whether it's transportation to community resources, providing food services if they're not available, identifying appropriate programming activities that might be available, the educational activities that might be available. But really, I think that community health navigator, whether it's a form of social worker or some kind of physician assistant role or something like that, would be really trained to have those compassionate conversations at that level in order to make sure that those connections are made within the community. And so, we see that as kind of a funded position that we really think would be a vital link to the community in which older adults like Roger live. If there's anything else that I'm missing, we had a lot of conversations, wanting to make sure that the needs are heard right from the beginning, and trying to identify various entry points that could be used to engage older adults. But that's kind of our moonshot idea.
I would like to thank all the participants in this group for their time, effort, and energy. As you can see, the group identified a variety of problems and ideas for how to meet the needs embedded in the scenario. If you or someone you know is experiencing social isolation, and the pandemic definitely contributed to more of us feeling that way, you can check out a program led by AARP, it's led by the AARP Foundation, called Connect to Effect. And their website is connecttoeffect.org. And that's CONNECT, the number 2, and then AFFECT.org. This website will give you more information on how you can get help for yourself or someone that you know. It can give you other ideas for how to support people in your area and learn about new interventions to help reduce social isolation. You can also take the isolation assessment and find local and online resources that will help you and or your family or friends, and also give you some different ideas of ways that you can volunteer to serve others. So you may have another idea or a solution for social participation, but if you know of a program that would help older adults and their families facing similar challenges, please drop your comments below this video or on my website, where this episode can be found at melissabphd.com. I'd love to hear from you. Thank you for joining us for this episode of This Is Getting Old, Moving Towards an Age-Friendly World. This 10-part series is sponsored by AARP's Community Challenge Grant and George Washington University's University Seminar Series, and is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities.